Imagine doing your makeup and finding a new hair growth spot that wasn't there before. Or maybe you're trying on your favorite outfit after months of diet and exercise to find that it still doesn't fit. Perhaps you're waiting for your menstrual cycle to come and it's been 3 months with nothing. This is the reality for approximately 7 million US women, according to the Pcos Foundation, and I am one of them. Polycystic ovary syndrome is a common disorder among women that goes largely undiagnosed and that most women don't know about, which is why I'm here today, to tell you what PCOS is and the risks, how it can be identified through the symptoms and how diagnoses are made, as well as how it's managed. I'll use information from the Pcos Foundation, Dr. McCullough's book, 8 Steps to Reversing Your PCOS, Dr. Goodwin's blog, The PCOS Nutritionist, and my doctor, Lisa Jukes. We'll start with what we're here for, which is to learn what PCOS is. PCOS is a common endocrine disorder among women. This means that hormones are the main factors responsible for the symptoms that women experience. Hormones are designed to work with systems in our bodies so that all the systems can work together to keep us healthy. And when one hormone is out of balance too long and untreated, it can create other risks. The PCOS Foundation outlines these risks in their educational materials online. According to the PCOS Foundation, reproductive disorders are a big risk, like infertility, which approximately 70% of cases are linked to PCOS. Miscarriages are also a common occurrence with PCOS. My coworker was diagnosed and has suffered from 3 miscarriages as a result of the diagnosis. Cardiovascular disease and diabetes are also big risks involved with PCOS, and mental disorders like depression and anxiety also are concerns. So now you know what PCOS is and you know some of the risks, but what you need to know are the symptoms and how they're used to make diagnosis. There are a large variation of symptoms associated with PCOS that the doctors rely on to make diagnosis. My doctor, Lisa Jukes, says PCOS is a variation of symptoms specific to each person rather than a standard set of symptoms. Besides facial hair growth, weight gain, and irregular menstrual cycles, women also experience insulin resistance. Dr. Goodwin estimates 70% of women with PCOS will suffer from insulin resistance. Other symptoms include male pattern baldness, no ovulation, and enlarged ovaries with cysts as a result. Dr. McCullough states, PCOS is a diagnosis that is exclusionary. Therefore, you must identify other disorders that can cause these same symptoms and rule them out first. Once you've ruled out some of these symptoms or diagnosis like thyroid problems, which are ruled out by labs, symptoms, and imaging, you can usually come to a definitive diagnosis of PCOS. Some doctors that are naturopathic even go as far as to make identifications of type A, B, C, or D with PCOS, meaning if you have a variation of hyperandrogenism, which is elevated male hormones, anovulation or no ovulation, and polycystic ovaries, they'll classify you based on which ones you present. So now you know what PCOS is and you know the risks as well as the symptoms and how you can be diagnosed. The most important thing you need to know is how it can be managed. Dr. Claire Goodwin says, the question women forget to ask regarding their PCOS the most is what causes PCOS. To figure out what is driving your PCOS, you need to identify your root cause, which comes from types A, B, C, or D. Once you know your root cause, you know what's driving your PCOS symptoms, sometimes it's possible to naturally turn off the genes that are responsible for presenting your PCOS symptoms. This is typically done through environmental changes like your diet, exercise, stress control, and then adding supplements sometimes as well. The instance of turning genes off is referred to as epigenetics. This is not always an attainable goal to only treat naturally for women. Sometimes they require a combination of natural treatment as well as medical intervention. My cousin has PCOS and she required birth control, spironolactone, and metformin to help control her symptoms. There's no one-size-fits-all treatment option for PCOS. It's a lifelong changing treatment plan, which is perfectly okay. So now you've learned what PCOS is, you know the risks, the symptoms, and how it's diagnosed, and you also know how it can be managed. As women, we are our biggest advocates for our health, and it's very hard to do that when you have a condition that most don't know about and that it doesn't get diagnosed all the time. I believe that by providing education to women, we can empower them to feel confident in prioritizing their health care, confident in pursuing proper diagnosis when things are not right, and they can feel knowledgeable about managing their PCOS throughout their life.